It's been nearly a year since the latest COVID booster shot was made available, and you'll soon have the chance to get an updated version. Former State Health Officer Dr. Thomas Dobbs, now working as the Dean of the School of Population Health at UMMC, is still fielding questions about COVID, including the booster shots.
I've had a lot of interest. A lot of people calling me, my own patients, and certainly people, in the community have been asking, when's it going to be available? The demand is still out there. So I'm excited for people to have access to it.
It comes as we're in the midst of the latest surge. Dr. Steve Threlkeld points out that the virus mutates quickly, making it tough for the vaccines to keep up.
Because this is an Omicron variant descendant, it's very contagious. And so these new variants take over one another. This current one is the KP 3.1.1.
But state epidemiologist Dr. Catherine Taylor knows COVID isn't dominating conversations as it was 4 years ago.
Unfortunately, people are not always as excited to get it as they were when COVID was new and scary. But still, for years we've been getting flu shots because flu is always around. Flu can always cause deaths. COVID is the same.
You may be wondering how far, if at all, that natural immunity will get you. We ask the doctors what to do if you've recently had a positive test.
We know a lot of people have had COVID right now. We're having like a little mini outbreak. So, give it a couple of months.
If you haven't had it for 4 to 6 months, then it makes very good sense to go out and get that, and with the hope that it will prevent you from getting any COVID for a period of months, and then continue to protect you downstream against the most serious forms of the illness.
If in doubt, ask your doctor. Now, both a Pfizer and Moderna vaccine have been given the green light by the Food and Drug Administration, and they do expect a protein-based version from Novavax to also be available soon. If you're wondering what that means, unlike the other two, it's produced in a similar way as the flu shot.